Now, a lot of people, your ulcer have graduated from Harvard University. You know what I'm trying to say. Like, it doesn't work again with medication. You cannot eat in peace again. Nothing works for it again. It doesn't go again. Like, it keeps coming back even after treatment. You bleed inside. There is perforation, and you can't even eat at all. Whenever you remember the pain, you will not be able to eat. Now, you need surgical intervention. Your doctor will tell you. That is why I said, go to hospital and get evaluated so that you'll be able to know exactly what is wrong with you. Some people don't even know that they have perforation. That is why the pain and the discomfort they usually experience is on the high side. Yes. So whenever you have any of these symptoms, it doesn't tolerate medication any longer. It keeps coming back. You bleed inside. You can't eat. There is blockage of food and then perforation. When there is opening, already there is wound. Maybe the stomach is now open somewhere and you won't even know. That is why the discomfort and the pain will always increase. Like, even after taking medication, you eat, you can't be able to eat. Know that you need surgical attention. Your doctor will tell you if you need one anyway. So, and the doctor will recommend any of these 3 surgeries done for people with ulcer. Number 1 is vagotomy, 2 is enterectomy, and 3 is pyloroplasty. Forget about the names, just forget about it. I'm just trying to tell you something. The first one, which is vagotomy, there is a nerve, just like Aquara. There is a nerve that is responsible for sending signal to the brain, telling the brain to secrete stomach acid, that acid that is causing the pain and the irritation in the stomach. So during the surgical intervention, the surgeon will just cut off this nerve. And once the nerve is cut off, you'll be fine. Like, you'll be fine. So it all depends on the severity of your ulcer that will now make your medical expert to suggest surgical treatment for you. Then the second option or the second procedure here is what we call enterectomy. Now, part of the stomach is called the antrum, and that is where the secretion of this stomach acid is, coming from. So during the surgery, the surgeon will just cut it off, will just remove it. Do you understand? It will be removed and then sutured back. The symptoms and the amount of gastric acid, that is the stomach acid, released will now be very small, and your symptoms and signs that you are having will now be reduced, and you will be fine. The last one is called pyloroplasty. Big name. Here, we normally do this one when a patient is having blockage of food. Those people that cannot eat, it can't pass. When food can no longer pass, there is blockage. Now, what the surgeon will do is, between the last part of the stomach and the first part of the intestine, that is at the pylorium. I don't know how to tell you now. Okay, let me use the word duodenum. Just doing that at that area, what the surgeon will do is to widen the parts. It will now be wide so that food can pass freely. So for somebody who is already having blockage of food, of course, you know that if you take all the medications, it will not work for you. This information I'm giving out is not to substitute your medical visit. No. Please, always seek for medical advice. Go to hospital. Get yourself evaluated. Please. If this video is useful to you, of course I know it's useful. Yes. Please follow me, like, comment, and share. Very important. Share my videos, please. And don't forget to subscribe to my YouTube channel at Nurse Prudence, please. Until I see you again in my next video, please do take care of yourself and drink plenty of water.